the phone. So it's not always about being smart, it's just about being there. Now, contrast that with my friend who didn't want to join Choice Care because she didn't want me to see her naked. It's true. She has lots of money, she knows the system, and she's never been sick, so why would you want to invest in your care? And that's fine, that's her choice. And we had dinner, not this last Tuesday night, but the Tuesday night before, and I find out on that Friday evening that she was admitted to a hospital shortly thereafter. Tuesday night, she called an ambulance after she got home because she had intense back pain. She could hardly move. The ambulance took her to Kaiser. She got morphine and was sent home. Pain continued. She called the ambulance again and said, "Do not send me to Kaiser." She went to St. Joe's. There the story gets a little mucky, and I find out on Friday evening that she's there and in serious condition, about ready to go into the ICU, and I find her daughter, and I call her daughter, "What's up? What happened?" "We don't know. Mom has horrible pain. She can't move her legs. She has a fever of 103. She has gram-positive cocci growing in her blood, 3 out of 3 cultures or staph." And I said, "Well, where's the neurosurgeon? What did the MRI show?" I mean, this is an epidural abscess, right? They didn't know. MRI hadn't been read yet. So I called a friend who knew a friend at St. Joe's and got a neurosurgeon out of the operating room to go read the damn MRI. Short and long of it is that she finally did get her surgery and she's going to be fine, and after I finish here today, I'll go and visit her. But that's not because the system works. That system didn't work either. She has all the money in the world. She had insurance, but she didn't have an advocate. She had a hospitalist. Remember those hospitalist things? The people who take care of you for that very short period of time when you're the sickest, who know nothing about you. What I knew is that that patient, Kathy, had fallen off a horse and she had a long-standing back injury. You know, those kinds of things that actually when you get a bacteremia or septicemia are just right there for the wonderful bacteria to set their colony up in. But if you know your patient and you're their advocate, you can find what's in their best interest. If you don't have their interest at heart, if you're addressing an insurance company or the government, you'll go around and around in circles. And everybody in this room goes around and around in circles every day. My day, too much of it is still spent on the phone begging for my patients' medications. I still have to deal with insurance companies and the government, right? That doesn't change just because I don't take their insurance. It doesn't mean that they don't have insurance. But I so believe in our patients' rights, their right to choice, and their absolute right to self-determination, that I will do whatever I need to do because it is in my self-interest. There is nothing better than a thank you at the end of a day. And every doctor in this room knows that that's the most valuable thing that we have. If it only paid the electric bill, we'd all be multimillionaires. But it's worth it. What you need to do is you need to escape from the system and give yourself the opportunity to work for your patient and do what's in their best interest. What do I sell my patient? I sell them a better, more productive day. An opportunity at a better day. That's it in a nutshell. I'm actually an economist. I went to Wesleyan. I was an economics major, and I wrote literature a long time ago. And I'll be happy to talk to you about that in another day. But the solution for healthcare is first, the patients have to own it because they own their life, and it's their right to invest. They need to know the cost of that care. We need transparency, and every physician in this room should be posting their prices, and every hospital should be posting their prices, because you cannot state the value of anything unless you know what it costs. And we need to compete to be better doctors, to work better for our patients. And then they need to compete with us. And everybody needs to do it better, because our patients do deserve a more productive day. But it is up to them to find it for themselves. And I think it's our profession that can help them do that. Thank you very much.